is Eilis Hennessy, and I'm a professor of developmental psychology in the School of Psychology in University College Dublin. You're very welcome to this webinar, which is presenting the findings of a project that has been ongoing for the last year, looking at parent needs for support for adolescents who self-harm. I'm joined this afternoon by Aine French, who is the research assistant who has been doing such extraordinarily excellent work on this project and who will be co-presenting the session this afternoon with me, and by Niall Hogan, who has been supporting us not only in some aspects of the work since on this project since January, but who's also supporting us with the dissemination of the project. Niall is not presenting this afternoon, but we'll be back in later on when we come to time for questions. So let me start off then by telling you a little bit about the background to this project. So this is a project that is run by UCD School of Psychology and Pieta. So Pieta is a self-harm and suicide prevention organization in Ireland, the largest in the country and probably one of the largest specific ones in Europe at any rate, as far as I know. So very specifically, the research project which we were funded for, and our funding has come from the National Office for Suicide Prevention, was designed to find out what parents would want to know about adolescent self-harm. And this arose from previous research that we had done with therapists within Pieta to understand what they believed would be helpful to parents. But before I say more about this project, I wanted to alert you to another possible project or another possible event organized in UCD psychology that might be of interest to you, and it's a separate project from this, but it's on a related topic, and this is an in-person event. It's a small event, but we do have a very small number of places left. So if anybody would be interested in joining us on the Belfield campus on Friday, the 6th of May, between 11 and 3, please contact Doráine Murphy. Her email address is on this slide now, and we're going to be talking about the kind of support that parents need when they are supporting an adolescent with mental health problems. We would particularly welcome clinicians and other professionals to join us, so GPs, psychologists, psychiatrists, social workers, OTs. We have parents joining us and a range of others, so please do email Doráine if you would be interested in taking part. So back to today's project. So as I said, my name is Eilis Hennessy and I'm the principal investigator on this project, but I'm certainly not doing the project on my own. You've already met Aine French. The project is also run with Assistant Professor Nikki Nayarku from UCD School of Psychology and Assistant Professor Keith Gaynor from the UCD School of Psychology, he's also a senior clinical psychologist. And the team from Pieta is Sinead Raftery, who is a senior clinician within Pieta, Brígeo Dwyer, who is head of research in Pieta, and Emma Dolan, who is head of clinical services within Pieta. And we put in this proposal to NOSP together. I mentioned very briefly there that we know that self-harm is a common problem among adolescents, and the My World survey, both rounds of the My World survey, which was very large data sets collected from adolescents in Ireland, showed that 23% of 12 to 19-year-olds reported that at some point in their lives they had self-harmed. We also know from a previous research project that was led by Keith Gaynor that therapists from Pieta reported that they could have done an awful lot for young people simply by talking to their parents. So again, this was putting parents as key people within our understanding of supporting adolescents who self-harm. We also know of other academic research projects that have found that parents need support in order to help an adolescent who is self-harming. So parents need information. What we set out to do was something actually very practical. We decided that what we would investigate is the nature of the information that parents wanted, and where they would like to access that information, and who they would trust as a source of that information. So we had those as key, very practical aims for the project. We worked with an advisory panel so that we had a group of people who would be end users of this information to guide us in our work. And that was parents with lived experience. By that, I mean parents of adolescents who had themselves parents of adolescents who had self-harmed. We had psychologists, psychotherapists, and social workers, all of whom were had a lot of experience working with young people in self-harm. And then we had a parent line responder who was used to dealing with the concerns of parents when they first discovered adolescent self-harm. What we proposed and what we were funded to do was a series of 3 studies, but as I say, they were unified by that single goal of understanding exactly what parents wanted to know. We started out with a rapid literature review. This literature review was designed to find out what research is out there already. This was really very extensive. We looked at over 8,000 records. And very importantly, something that we will come back to at the end of this presentation, we screened 100 websites with information for parents. From the 8,000 records, we generated 36 journal articles that appeared to be relevant for our understanding of what parents might need. And we took all of the information that we had learned from that rapid literature review, and we turned it into, or we used it as the basis then for the next 2 studies. One was an online survey with parents, and the other what's called a Delphi study, and I'll explain that in a moment. So our online survey was gathered information from 128 parents. All of these parents reported that they were the parent of an adolescent who had self-harmed. And it was to these people, as people with real experience of what it is to need and want information, that we asked our key questions about information needs, about where they would like to get information, and what sort of who they would trust as a source of information. Our Delphi study was designed for professionals. This was a 2-round Delphi study. The idea of a Delphi study is that it's aiming to get consensus. So you ask people, first of all, a very wide range of questions, which you then narrow down in the second round. And the idea is you look to see whether there is an emerging consensus as people learn, as people have longer to think about the answers they have given and have had time to look at the answers that other people have given. So within this Delphi study, we had 25 professionals from a range of backgrounds, psychiatrists, psychologists, social workers, and so on. They had each had an average of 9 years experience, and all of them had at least 2 years of experience of working with young people who self-harm. We thought it important to have the clinicians because sometimes, or we thought it was possible that there might be things that clinicians would realize from their extensive work with parents and adolescents that might be gaps in parent knowledge. And so we wanted to make sure that if there was something clinicians knew about, that we would not miss out on providing it for parents. So with that, to tell you a bit about what we found from these, I am going to hand over to Aine, who's going to bring you through the findings.
Thank you, Eilis. I hope I'm unmuted now anyway. But yeah, so the first thing I'm just going to cover is a little bit on the general recommendations that we found coming out of this. Then I'm just going to cover a little bit on, we broke it into 2 different kind of sections. So we looked at immediate needs that parents would like to know on initial discovery of self-harm. And then we looked at needs that parents might need, information that parents might need to know on an ongoing basis of self-harm. So the general recommendations that came up initially were parents reported they would benefit from hearing some of this information from other parents with lived experience. Also, that information is tailored towards specific needs or minority groups, including but not limited to the traveller community, the LGBTQI+ community, or adolescents with additional difficulties or ongoing difficulties as well. So just to start with kind of the immediate information needs, and we identified 7 of these, and these were needs that parents would like to know on initial discovery of self-harm. It doesn't necessarily mean that they are any more or less important than other information needs that parents had on an ongoing basis, but just that it was more important on the initial discovery. Just to give you a little bit of an idea of how these were selected, from the rapid literature review, Eilis mentioned that we had identified 38 items. All of these items were rated as either essential or important by at least 80% or more of parents, and by 80% or more of professionals for the most part. There was a tiny bit of a discrepancy there, but I will address those when they come up. I'm also going to give a little bit of like guidance or suggestions around each of the items, which will also be included in the final report. Or say things like it was decided. And by this, I mean that the decision was based off recommendations from our advisory board, from the research team, from the rapid literature review, and then also just from open-ended questions in the surveys, both with professionals and parents. So the first thing that parents would like to know more information about is how to have that initial conversation with the adolescent, if the adolescent has told them, or if they've discovered that the adolescent is self-harming or suicidal, and what they should say to the adolescent if that was to happen. That not only kind of what to say, but also what not to say came up a little bit. The parents would like, there was a little bit of almost anxiety around saying the wrong thing. So parents would like, if possible, even almost a script of phrasing to use or phrasing to avoid around self-harm and suicide, and how to discuss that with their adolescent when they have initially discovered either being told by the adolescent themselves, being told by somebody else, or noticing. And that brings us on to the next topic, which is what signs might indicate self-harm. So parents would like more information on warning signs of self-harm. It was noted that self-harm isn't always easy for parents to identify. Parents would almost like a list of warning signs if possible. And it was also noted these might be used to kind of initiate the initial conversation. I noticed this or that, and that might be a benefit from this information also. I will also say that I won't necessarily be answering these questions, as that wasn't part of the kind of that wasn't part of this project, but that we have a second webinar coming up on Tuesday, and the fantastic Dr. Gaynor and Sinead Rafferty are going to be addressing those, and if that's of interest. So another information need that was identified was, if I know my adolescent self-harms, should I ask them whether they're thinking about suicide? And this came up as a real concern on the initial discovery, and it was a concern that parents had and rated very, very highly, and also that professionals rated very, very highly. How to have that conversation around suicide, and how to address thoughts of suicide, and how to keep them safe. In particular, this was around how to discover an adolescent's reasons for self-harming, and also, you know, whether that conversation might put the idea in an adolescent's head, and parents would like more information on how to address that with the young person. So the next one was, again, this is in the initial needs, but this one was identified both as an initial need and as an ongoing need. How can parents manage their own emotional response to the discovery of self-harm? So it was very important for a parent to know what to expect from their own response, and a lot of parents identified feelings of panic, shock, or anger on the initial discovery, but wanted more guidance on how to manage that response in a way that they would be best able to give the young person support they needed at that time. On a more ongoing basis, parents reported a need for more information on self-care, how to deal with feelings such as guilt or self-blame, and also just how to generally, the professionals identified a need to encourage more positive coping skills for adolescents or for parents themselves. Walking on eggshells was another phrase that came up a little bit, how to cope with that feeling around ongoing needs. So parents would also like more information on how to support a young person to use alternative emotional regulation strategies. Should I put away anything my adolescent could use to hurt themselves? So means restriction and alternative emotional regulation strategies. Now, initially, these were two separate items, and it was from the guidance and the advice, both from the advisory board and again from comments from parents and professionals and from the rapid literature review that encouraged us to make this one item. And it was highly recommended that this, whenever means restriction is an item of information that you're giving information about, that the use of alternative coping regulation strategies should also be a part of that item, that they shouldn't be given in isolation. It should also potentially, if possible, have some information on the use of self-harm as a coping strategy. So if that is something that can be all put into one item, that is how it was recommended it was best to be delivered. Also, again, another list of alternative coping strategies that might be useful. So the last two items that were requirements for parents on immediate needs were around help seeking. So the first was, where do I go for medical attention for my adolescent? When is it needed? And what do I do if they refuse medical attention? Information on this should kind of make sure that the parent understands that if necessary, they may need to make an executive decision around this. Additionally, it was recommended that some other aspects of keeping them safe, such as maybe wound care or preventing infection, if the adolescent refuses to attend medical care. This was a separate item around first aid, wound care and preventing infection that didn't actually reach consensus. It was one of the items that was not initially included, but it was considered to be relevant as a sub-item to this question. So the last question that parents had on initial discovery was, where do I go for psychological support for my adolescent? When is it needed? And what do I do if they refuse psychological support? So how, where to access. They wanted more information as well on whether psychological support would cost money and where to access free services if possible, or for themselves and for their adolescent, and how to encourage a young person to seek psychological support if self-harm is ongoing, and advice on overcoming kind of objections to that, or encourage them more to seek that support where necessary. This is also a very interesting item, especially coming up from, again, the literature and also from parents themselves. But a lot of parents identified that they felt they had not sought psychological support early enough, and that they would like to, they feel the information should be there to allow them to do that sooner. So just coming to the end of our information initial needs section, this is just an example of when we did our rapid literature review, as Eilis discussed, we looked at articles, but we also looked at websites and what's already available out there for parents. So we identified 56 websites, and of those, what I have here is the comparison between the initial needs that we identified and the parents identified, and then what was already available on those websites. So for example, the first item there, how to respond on initial discovery, was pretty good. It was reported, information on this was given on by 84% of websites. For the warning signs for self-harm, information was given on 70% of websites. For items 6 and 7 there, how to contact medical services or professional supports, was given on 84% of websites. That was pretty good overall. But then you can see that despite the fact that over 80% of parents feel that it's essential or important to have information on how to ask if an adolescent is thinking about suicide, it was only on 63% of websites that parents would have had access to. How parents manage their own emotions was reported on only 36% of websites. Alternative coping strategies and access to means of self-harm and restricting access was reported on only 50% of websites. And what's interesting about this as well is this isn't necessary to say that these items were all following the recommendations that this study found in terms of things like having alternative coping strategies paired with means of with access restriction. And then the final item I just have there is overall how to manage a self-harm crisis in the moment. And that was there was only information given on 38% of websites for that, which I will come back to in a second. It wasn't an initial need that was identified, but more of an ongoing need. But I thought it was particularly relevant here. So with that, I'm going to go on to the ongoing information needs. Those first 7 were identified as necessary and immediate discovery. That doesn't mean that these are any less necessary. Parents still rated all of these as essential or important. Well, over 80% of parents did still identify these. So they are still very important. It's just they become more important when ongoing support. So the first of these is parents would like more information on why do adolescents self-harm. I know we already touched on that in relation to suicidality, and that was specifically in relation to suicidality in order to keep them safe, but this was more broad than that. It was also related to some parents noted, self-blame around was it something they did, and they would like more information on why adolescents engage in self-harm, how common is self-harm or suicide in adolescents as well. So statistics around that. Parents would like a little bit of information on that. Just kind of general psychoeducation, risk factors that might predispose adolescents to self-harm was mentioned. Also, actually, the importance of taking self-harm seriously, and the importance that parents are reassured that services will take self-harm seriously also kind of came up in the general psychoeducation piece. Next thing that parents would like information on is how to understand the adolescent's individual triggers for self-harm and what to do to help the adolescent with the feelings of needing to self-harm. So, for example, helping to distract them was the example given, and may not necessarily be the recommendation, but just that parents want more information around that. It's related again, kind of back to item 5 of the initial needs. On this specific instance of self-harm, but it was identified as being a distinct need. This also kind of ideally should address whether the adolescent should tell a parent or should tell somebody they trust when they have the urge to self-harm, and if that would be something that was useful, how to have that discussion with them. It's also partially related to how to support the young person while they're engaging with a professional and how to support that formal support that they're receiving, and also a little bit on how to prevent further episodes of self-harm if possible. So the next was what parenting strategies can they use to help, how to set boundaries, and again, are there things I should avoid doing? So I know I mentioned this previously in relation to the very first item. Parents want to be sure that they're not saying the wrong thing. Similarly, parents want to be sure that they're not doing the wrong thing, and even maybe even just need reassurance around the fact that maybe they're not doing the wrong thing, So just general advice on practical actions parents can do on a day-to-day basis to support an adolescent, how to set limits on behaviour in a way that doesn't trigger self-harm for the adolescent, information on vigilant care and monitoring, and how this can be achieved in collaboration with the adolescent if possible. The other thing that came up in relation to this question was how to manage threats of self-harm, what information on what a parent should do in relation to that. And also, this was also emphasised as an ongoing need, but also in relation to after cessation of self-harm, that parents would also like to know how to continue using these kind of supportive strategies. Is there something I could do to strengthen my relationship with my adolescent? Was something that parents want to know more about. This ideally could include how to build and maintain open and supportive communication with the adolescent, and again, kind of learning those additional emotional regulation skills and supporting their use of alternative coping skills. Also just enhancing the parent-child relationship through supportive parenting strategies, through helping the adolescent cope, and even just guidance on ideas to spend more time with their adolescent was another thing that came up out of the rapid literature review. Is there something I can do to make it better, and how do I manage this feeling that I should fix it? So this was a bit of a complicated question, and this one was rated high. This was rated essential or important by 80% of parents. It was just under the consensus. It was 76% of professionals, and it was decided that it should still be included. One of the difficulties here being that perhaps the response to the words kind of fits it, like the issue for the adolescent. But also that maybe it's important to include because parents need to know that sometimes there is no quick fix, and maybe they are doing everything right, and that is something that they need more information on, but also acknowledgement that the course of self-harm can vary per person, but it might be a once-off or it might be ongoing. Parents would like more kind of statistics around that, but also to know what they expect. And I know that sounds like a little bit of a paradox there in terms of they want to know, I'm saying about acknowledging that self-harm differs, but then I'm also saying that they want to know what to expect. But even just statistics around that in terms of, how many continue to self-harm and things like that, it's something that parents want to know. Parents would like to know a little bit more about should they tell their other children what's happening, and this was almost a bigger question, also how to tell the other children what's happening. This was almost a bigger question on the impact that self-harm can have on the family as a unit, and how parents can manage their worries about the impact of self-harm on the unit. Again, this was an item that was rated essential or important by 80% of parents, but 76% of professionals. So again, just under that threshold. But parents want to know more information and guidance on how to talk to their other children, where it's appropriate, in what way, and when it's developmentally appropriate. There was also a discussion around possible that this might be different depending on their age, that older children who are present in the house are probably aware that something is happening and how to speak to them about it, while keeping kind of privacy concerns for the adolescent, and that's a bit of a balance. But again, whatever the response is, parents want to know more about that. Also, in terms of, I was speaking about it having an impact on the family unit, but that parents want to know how best to balance the needs of the adolescent who's self-harming with the needs of other children in the family. So parents also, this was an interesting one that came up because again, I know I touched on it with regard to the initial needs, but this is one that was this was not represented very highly on any websites, but it's something that parents really want to know, and what treatment options might be offered and what's involved in them. So cognitive behavioral therapy, family therapy, medication, when or if any of these are options, and what they are, what cognitive behavioral therapy is, what it entails, how long it might go on for. Parents want these kind of expectations set kind of as soon as possible. So not in the initial phase necessarily, but when the self-harm is ongoing and they've started to receive support, parents would like that information there. Also just practical expectations around, will the parent need to take time off work to bring the young person to their appointment? How do they arrange those appointments? Do they call up the person? Do they send a referral? Is it an ongoing thing? So parents want more information on that. They also want information on, again, expectations around what will happen if they bring their young person to the GP, if they bring the young person to accident and emergency, so what to expect when they get there. Parents would like to know more on what they should do if their adolescent doesn't connect with the person who's helping them, and how to address this, how to encourage the adolescent to access and engage in intervention when they're a little bit reluctant. Parents also want to know how they can support the professional to do their work with the adolescent, obviously again within limits of confidentiality and while allowing the young person their space that they need. But parents want to be there, and they want to support it, and they want to know what they need to know to help them. This was also kind of around just collaboration with the professional treatment, and keeping communication going with the therapist or professional that they're seeing. Parents would like to know what kind of ongoing formal or informal supports might their adolescent need. This was another question this was rated really, really highly. This was actually rated essential or important by 91% of parents, but by only 60% of professionals. And one of the things around this may be that this should also include, in terms of when you're providing information on this, that the guidance suggests that it should be included that many adolescents may not need ongoing support. And the same for the question that's coming up, not maybe next, but in a little while, about parents, whether parents will need it, that not all parents will need it, but parents identified that they would like to know what kind of ongoing formal or informal support an adolescent might need if they need it. So the kind of course of what expectations, again, of the course of intervention and of self-harm. So yeah, it is the next question. How can parents access professional supports for themselves if necessary? So again, rated highly by over 80% of parents. But actually, this was even lower, 44% of professionals. But again, the reasoning being, coming from the professionals and from other sources, that most parents may not need it, you know, and they don't necessarily feel the expectations to be set up that all parents need it. So if this information is something that's being provided to parents, that it is emphasized that not all parents will need it, but this is how they access and this is how they receive that support if they feel they would like it. This was another one that was actually identified more in terms of following cessation of self-harm. Parents still would like information on this. And finally, this one is also on, I suppose, after following cessation of self-harm, how do I tell if my adolescent is continuing to self-harm or has resumed self-harming? And this was actually rated, I know Eilis identified that we had our list, but also that the last section there was an open-ended question that parents could identify what their needs were at initial, ongoing, and then following cessation of self-harm. And this was one that was identified as following cessation of self-harm. Parents would like to know what kind of signs there are that an adolescent is continuing to self-harm. So although the warning signs is a little bit related to this as well, that this is something that parents would still need to know after they've engaged with professional services. So the next section was on how parents would prefer to receive the information. And again, what I'm showing here is actually the parents rated this as yes or definitely. The 90% said that they would like to receive information on a website, either a charity or a government website. And this is great. As you can see, there are websites out there, but they don't necessarily all contain the information that parents are looking for. So there is a need for that there. Helpline was rated by 73% of parents, and it was suggested that this might be because there wasn't necessarily a helpline that parents knew about to go to, and the same for the professionals, that professionals felt it would be important by about 96% of professionals felt it would be good for them to receive information from the helpline, but that maybe there wasn't one in mind when they were filling out the survey. And then finally by leaflet, 61%. And also interesting to note that a lot of the websites actually had PDFs as well. So in some cases it kind of doubled as both. And then trusted information sources. So who parents would like to receive information from. And the top rated one here was a psychologist or a psychotherapist. Secondly, a charity mental health service. And then finally, a local GP. And this was also very consistent with the professionals. Professionals actually rated at 100%, 100%, and 96% respectively. Parents also reported that they'd like to hear more from other parents with lived experiences. They also reported that they would trust the information coming from schools if it was something that schools were in a position to do, that's something that they would like to receive. They would like to receive information from schools if the school is in a position to do that and they have a good relationship with the school. Or potentially, again, from parents with lived experience, be that through a video on a website or a short piece written by a parent. Okay, and I think Eilis is going to jump back in.
Yes, thank you very much indeed, Aine. That was a fantastic run through of our key findings. So while Aine was talking, I was monitoring the questions coming in on the Q&A and on participants. So just before I talk about the conclusions, let me just say that the session today we had really thought of as a session primarily for professionals who work with parents or parents and young people who self-harm. That's why we're focusing on the questions. So what we wanted to know is, what do parents want to know? The answers to those will depend on what group of parents you are presenting information to. So, I mean, at the kind of, at one level, you could see that if you were presenting information for for the parents of younger children, say up to age 15, you might want to style your answers in one way versus for older adolescents, you would put it in another way. Similarly, if you were looking to the parents of particular groups, so as Aine mentioned, some of the groups that were mentioned as needing maybe particularly well-focused research or information are travelers and parents of LGBTQ plus adolescents. So we believe that the answers, the information that you're going to provide to parents will have to be targeted towards the group of parents that you're serving. So that's why we're focusing on the questions and not on the answers. We will be having a session next Tuesday evening. That is going to have a presentation, as Aine mentioned already, from Keith Gaynor and from Sinead Raftery, and they will be focusing more on the answers. So if you're a parent and you have questions that you would like about or you would answers to, so that's the session to come along to, and you can register on Eventbrite for that. Okay, so before moving to taking some more general questions, let me briefly give a summary of our conclusion. So firstly, as I mentioned to you, we had sought to seek the advice of parents and of professionals. We did that because we thought there was potential for them to have some slight differences in what they thought parents would need to know. But in fact, overall, it was clear that there was far more agreement than disagreement. In the main, parents and professionals were very much of one in understanding what parents needed to know about adolescent self-harm. Aine has highlighted some of the places where there were differences. In our results and in our recommendations in our report for NOSP, we will be highlighting what the parents said they wanted to know, because it's the parents we're really focusing on. But nonetheless, it's just to say that there was more agreement than disagreement between parents and professionals. The other interesting thing, I don't know if this has struck many of you as you were listening to Aine's presentation, that it's clear that parents want information not just on the very specifics of self-harm and how to support an adolescent who's self-harming, but also on the implications of self-harm for the wider family. So for the parent themselves, how they can manage their concerns, their worries, how they can manage talking to siblings, how they might deal with talking to the school about this. So it's very clear that the implications of adolescent self-harm go well beyond the specific adolescent themselves, and parents need more broader information than simply on managing a single adolescent who is self-harming. So again, I think that was an interesting and important finding. And then the final point here, I think, is really crucial, and that is that our search of websites really highlighted that many of the information, the pieces of information that parents indicated were important or essential for them, are simply not readily available on websites at the moment. So if you're taking part in the webinar this afternoon, and if you are somebody who is in the business of providing a service for parents or for young people, please take this into account. Please think about the possibility of your organization's website, if you have one, thinking about providing information for parents. There is definitely a need out there. And when our report is published, which we hope it will be within the next couple of months, we have a full list of all the websites that we reviewed, so that it will be very easy for somebody else to come along and look and see what's out there and see whether if there's any new information that they could provide. So there is definitely a gap out there in the information that parents need. Okay, So with that, I'm going to stop talking and thank you all for your attention.